Putting the Promise of Olmstead into Practice, Minnesota's Olmstead Plan, August 10, 2015 revision. Written by Minnesota Department of Employment and Economic Development, Minnesota Department of Human Services, Minnesota Council on Transportation Access, Minnesota Department of Education, Minnesota Department of Health, Minnesota Department of Transportation, Minnesota State Colleges and Universities, Olmstead Implementation Office. Published by Minnesota Implementation Office. Copyright 2015. Copyright owner, Minnesota Implementation Office. This is a recording by Minnesota State Services for the Blind. Any further reproduction or distribution in a format other than a specialized format is an infringement of the copyright. This book has one DAISY navigation level. Level 1 contains feedback, contents, sections, appendices. Feedback. The Olmstead Subcabinet welcomes feedback to form the implementation of Minnesota's Olmstead Plan. There are several ways to provide your comments and thoughts. I'll read the method first, followed by steps to follow. Online. 1. Go to mn.gov/Olmstead, OLMSTEAD. 2. Click Participate and follow instructions for the online form. In an email, send an email to this address, mnolmsteadplan@state.mn.us. In the mail, send a letter to Olmstead Implementation Office, 400 Sibley Street, Suite 300, St. Paul, Minnesota, 55101. On the phone, speak to a staff member at the Olmstead Implementation Office or leave your comment on voicemail, 651-296-8081. Contents. Introduction and background information, page 8. Introduction, 9. Background information, 9. Olmstead versus LC, 9. Federal enforcement and guidance related to the Olmstead decision, 10. Why does Minnesota have an Olmstead plan, 11. Developing Minnesota's Olmstead Plan, 11. Olmstead Subcabinet Vision Statement, 12. Demographics and Implications, 12. Public Comments, 13. The August 2015 Plan, 16. Measurable Goals, 18. Topic Areas and Measurable Goals, 19. Measurable Goals, 20. Format of Topic Areas, 21. Measurable Goals at a Glance, 22. Person-Centered Planning, 32. What this topic means, 32. Vision Statement, 34. What we have achieved, 34. Measurable Goals, 35. Transition Services, 38. What this topic means, 38. Vision Statement, 39. What we have achieved, 39. Measurable Goals, 39. Housing and Services, 44. What this means, 44. Vision Statement, 44. What we have achieved, 44. Measurable Goals, 45. Employment, 48. What this topic means, 48. Vision Statement, 49. What we have achieved, 49. Measurable Goals, 50. Lifelong Learning and Education, 54. What this topic means, 54. Vision Statement, 54. What we have achieved, 55. Measurable Goals, 55. Waiting List, 58. What this topic means, 58. Vision Statement, 58. What we have achieved, 59. Measurable Goals, 59. Transportation, 64. What this topic means, 64. Vision Statement, 64. What we have achieved, 64. Measurable Goals, 65. Healthcare and Healthy Living, 70. What this topic means, 70. Vision Statement, 71. What we have achieved, 71. Measurable Goals, 71. Positive Supports, 74. What this topic means, 74. Vision Statement, 75. What we have achieved, 76. Measurable Goals, 76. Crisis Services, 82. What this topic means, 82. Vision Statement, 82. What we have achieved, 82. Measurable Goals, 83. Community Engagement, 88. What this topic means, 88. Vision Statement, 88. What we have achieved, 88. Measurable Goals, 89. Topic Areas under Development, 92. Assistive Technology, 92. Preventing Abuse and Neglect, 92. Plan Management and Oversight, 94. Plan Management and Oversight, 95. Olmstead Subcabinet and Olmstead Implementation Office, 95. Quality Assurance and Accountability, 95. Quality of Life Survey, 96. Dispute Resolution Oversight, 97. Updating and Extending the Olmstead Plan, 97. Communications and Public Relations, 98. Cross-Agency Coordination of Data Strategies, 98. Cross-Agency Coordination of Legislative and Funding Strategies, 99. Definition of Key Terms, 102. Common Acronyms, 108. Appendices, 110. Appendix A, Governor's Executive Orders related to Olmstead, 112. Appendix B, Sample Work Plan, 122. Appendix C, Index of Documents related to Olmstead Plan Implementation, 132. Minnesota Olmstead Subcabinet, August 10, 2015. To the people of Minnesota. On behalf of the Olmstead Subcabinet, I am pleased to present this new Olmstead Plan for the state of Minnesota. The title of the plan, Putting the Promise of Olmstead into Practice, Minnesota's Olmstead Plan, speaks to our intentions and our commitment. We are firmly committed to building a future where people with disabilities experience lives of inclusion and integration in the community, just like people without disabilities. We envision a Minnesota where people with disabilities have the opportunity to live close to their families and friends and as independently as possible, to work in competitive, integrated employment, to be educated in integrated schools, and to participate fully in community life. This plan is about choice, not about closure. The goals in this plan will pave the way for Minnesotans with disabilities to express their preferences for how they choose to live, learn, work, and engage in community life while receiving the supports they need. The goals are also focused on increasing the options available for people with disabilities when they express those choices. We intend this plan to be both a proclamation of our commitment to integration and inclusion and a vital dynamic roadmap for making our vision a reality. Because we will learn by implementing the plan, it cannot be a static document. We expect that people with disabilities and their families will tell us what is working and what is not working when it comes to improving the quality of their lives. We will ask and we will listen, and we have proposed how we will amend this plan in the future to improve the outcomes of our actions. We see this as a starting point, not a final destination. Thank you to the people with disabilities that helped us to be bold in the commitments we make in this plan. Thank you to the staff of our agencies who have worked to create ambitious but realistic goals. Thank you to the thousands of people around the state who will work together on the many actions that it will take to bring reality closer to the vision statements expressed in this plan for more people with disabilities. Mary Tingertall, Chair, Olmstead Subcabinet. Introduction and background information. Introduction. The state of Minnesota is firmly committed to ensuring that people with disabilities experience lives of inclusion and integration in the community, just like the lives of people without disabilities. We envision a Minnesota where people with disabilities have the opportunity, both now and in the future, to live close to their families and friends, and as independently as possible, to work in competitive, integrated employment, to be educated in integrated settings, and to participate in community life. This Olmstead Plan is a groundbreaking, comprehensive plan to provide people with disabilities opportunities to live, learn, work, and enjoy life in integrated settings. We intend this plan to be both a resounding proclamation of our commitment to inclusion and a vital dynamic roadmap to making our vision a reality for present and future generations of Minnesotans. Background information. An Olmstead Plan is a public entity's plan for implementing its obligation to provide individuals with disabilities opportunities to live, work, and be served in integrated settings. It is named after a United States Supreme Court decision called Olmstead v. L.C. Olmstead v. L.C. arose out of the Americans with Disabilities Act, ADA, a landmark piece of legislation which Congress enacted in 1990. Congress recognized that, historically, society has tended to isolate and segregate individuals with disabilities, and, despite some improvements, such forms of discrimination against individuals with disabilities continue to be a serious and pervasive social problem. With those words, Congress equated segregation with discrimination, and in Title II of the Act, prohibited public entities from discriminating against individuals with disabilities. Regulations implementing Title II require public entities to provide services in the most integrated setting appropriate to the needs of qualified individuals with disabilities. Congress has explained that the most integrated setting means one that enables individuals with disabilities to interact with non-disabled persons to the fullest extent possible. This regulation is known as the Integration Mandate. Olmstead v. L.C. In 1999, the United States Supreme Court held that the unjustified segregation of people with disabilities violates Title II of the ADA. Olmstead v. L.C. involved two women with disabilities who were confined in an institution even though health professionals determined they were ready to move into a community-based program. The court held that the ADA's integration mandate requires public entities to provide community-based services to persons with disabilities when A. Such services are appropriate, B. The affected individuals do not oppose community-based treatment, and C. Community-based services can be reasonably accommodated, taking into account the resources available to the state and the needs of others who are receiving disability services from the public entity. To comply with the integration mandate, public entities must reasonably modify their policies, procedures, or practices to avoid discrimination. In Olmstead v. L.C., the Supreme Court stated that a state could meet this reasonable modification standard if it has a comprehensive, effectively working plan for placing people with disabilities in less restrictive settings, and a waiting list that moves at a reasonable pace, not controlled by endeavors to keep state institutions fully populated. The Olmstead decision is about more than how services are provided by the government to people with disabilities. It is a landmark civil rights case, heralded as the impetus to finally move individuals with disabilities out of the shadows and to facilitate their full integration into the mainstream of American life. Likewise, Minnesota's Olmstead Plan is more than a government planning document about providing services. In its fruition, the plan will facilitate opportunities for people with disabilities to live their lives fully included and integrated into their chosen communities. Federal enforcement and guidance related to the Olmstead decision. Presidents Bill Clinton, George W. Bush, and Barack Obama acted to support the Olmstead decision through federal agency initiatives. In recent years, the Department of Justice, DOJ, has applied an expansive understanding of the Olmstead decision. As examples, the DOJ has taken action against government entities that had long waiting lists for community-based services, against programs that placed too much emphasis on segregated employment, and against governments that attempted to reduce funding for personal care services, which could force people into institutional settings. The DOJ has also issued guidance for government entities to help them comply with the principles of the ADA and the Olmstead decision. Minnesota consulted this guidance in developing its Olmstead Plan. Why does Minnesota have an Olmstead Plan? Minnesota has an Olmstead Plan to ensure that Minnesotans with disabilities have opportunities for lives of integration and inclusion. To this end, in both 2013 and 2015, Governor Mark Dayton issued executive orders forming an Olmstead subcabinet and charged the subcabinet with developing and implementing an Olmstead plan. Moreover, we know that implementing a comprehensive, effectively working plan will keep the state accountable to complying with the letter and spirit of the Olmstead decision and the ADA. Beyond that, however, Minnesota has an Olmstead plan to fulfill an agreement made in the settlement of a class action lawsuit in U.S. District Court in a case called Jensen v. DHS. Jensen involved people with developmental disabilities who had been residents of a Department of Human Services, DHS, facility. In 2011, that case resolved in a settlement agreement which included a provision for an Olmstead plan. The settlement agreement stated, "The state and the department shall develop and implement a comprehensive Olmstead plan that uses measurable goals to increase the number of people with disabilities receiving services that best meet their individual needs in the most integrated setting, and is consistent and in accord with the U.S. Supreme Court's decision in Olmstead v. L.C. 527 U.S. 582, 1999. Developing Minnesota's Olmstead Plan. Minnesota began working on its Olmstead Plan since 2012. That year, the state formed the Olmstead Planning Committee, which included people with disabilities, family members, providers, advocates, and decision-makers from the Minnesota Department of Human Services, DHS. In January 2013, Governor Mark Dayton issued Executive Order 13-01, establishing a subcabinet to develop and implement a comprehensive plan supporting freedom of choice and opportunity for people with disabilities. The Olmstead subcabinet, then chaired by Lieutenant Governor Yvonne Pretner-Solon, includes the commissioner or commissioner's designee from the following state agencies: Department of Corrections, Department of Education, Department of Employment and Economic Development, Department of Health, Department of Human Rights, Department of Human Services, Department of Transportation, Minnesota Housing Finance Agency. Representatives from the Office of the Ombudsman for Mental Health and Developmental Disabilities and the Governor's Council on Developmental Disabilities are ex officio members of the subcabinet. In January 2015, Governor Dayton issued Executive Order 15-03, which further refined the role and nature of the Olmstead subcabinet. He subsequently designated Commissioner Mary Tingertall of the Minnesota Housing Finance Agency to be the chair of the subcabinet. Olmstead Subcabinet Vision Statement. To make the promise of Olmstead a reality in Minnesota, the subcabinet has adopted a vision statement to guide the implementation of the plan. People with disabilities are living, learning, working, and enjoying life in the most integrated setting. The Olmstead Subcabinet embraces the Olmstead decision as a key component of achieving a better Minnesota for all Minnesotans, and strives to ensure that Minnesotans with disabilities will have the opportunity, both now and in the future, to live close to their families and friends, to live more independently, to engage in productive employment, and to participate in community life. This includes the opportunity and freedom for meaningful choice, self-determination, and increased quality of life through opportunities for economic self-sufficiency and employment options, choices of living location and situation, and having supports needed to allow for these choices. Systematic change supports self-determination through revised policies and practices across state government and the ongoing identification and development of opportunities beyond the choices available today, and readily available information about rights, options, and risks and benefits of these options, and the ability to revisit choices over time. Demographics and implications. To better understand how to make the subcabinet's vision a reality, demographic information was reviewed about the state's population of people with a disability. Although this Olmstead plan applies to people with disabilities as defined in the ADA, available demographic data used a different definition of disability, one that excluded persons living in congregate settings. Footnote: 42nd U.S.C. Section 12102, the term disability means, with respect to an individual, A physical or mental impairment that substantially limits one or more of the major life activities of such individual, B, a record of such an impairment, or C, being regarded as having such an impairment. Continuing with the text, nevertheless, the information we have still helps us understand essential features and trends about the populations of Minnesotans with disabilities. For example, data shows that Minnesotans with disabilities live in poverty at a higher rate than Minnesotans without disabilities, and that the highest rate of disabilities among working-age Minnesotans are American Indians and U.S.-born African Americans. Minnesota's population is aging. The current retirement to working age ratio is about 22%, but by 2040, the retirement to working age ratio is projected to be almost 40%. According to a 2012 study on homelessness in Minnesota, 55% of adults experiencing homelessness reported a serious mental illness, 51% reported a chronic physical health condition, 31% reported evidence of a traumatic brain injury, and 22% reported a substance abuse disorder. 70%, 3,719 adults, reported at least one of these conditions. Recent media attention has focused on one disability that has increased dramatically. According to the Centers for Disease Control, autism has increased from a prevalence rate of 1 in 1,000 in 1970 to 1 in 150 in 2000 to 1 in 88 in 2012. These trends have implications for how best to address the needs of people with disabilities in Minnesota. Service planners must recognize that different communities, both cultural and regional, have different needs, and that unemployment and poverty continue to be significant issues for people with disabilities. The shifting prevalence of different disability types among different age groups will require changes in programs and accommodations in schools, employment, housing, and supports. The aging population in Minnesota has two big implications: an increase in the number of people with disabilities who may need services, and a decrease in the number of potential workers in direct service jobs. Public comments. Since drafting the original Olmstead plan, the sub-cabinet and state agency staff members have continued to accept and encourage public comments on the Olmstead plan and its implementation. Between June 2013 and June 2015, over 400 public comments were received by the Olmstead Implementation Office. In addition, since the original plan was submitted, members of the Olmstead Subcabinet and the Olmstead Implementation Office have attended more than 100 public listening sessions or information sessions with specific groups. We listen to these comments and use them to determine the scope of the plan, the topics it contains, and what outcomes the plan should achieve. All public comments were reviewed and distributed to the appropriate state agencies so that the agency teams would consider them in the drafting and implementation of the plan. Several themes emerged from stakeholder comments during the most recent comment period, April 24, 2014 to June 19, 2015. Footnote: these themes are based on a qualitative review of information from individuals who made comments online or at listening sessions from April 2014 to June 2015. We realize that these opinions may not reflect the opinions of all relevant stakeholders or Minnesotans in general. Continuing with the text, of the 175 comments received, 80% of the comments related to 11 theme areas. Those themes are summarized below and indicate the number of comments related to the theme. The total comments exceed 175 because some individuals commented on more than one area. Theme definitions. 1. Options and choices, 107 comments. People expressed that a one-size-fits-all plan will not work. An array of options needs to be funded and available for people to meet the needs and choices of individuals. An example would be providing opportunities for integrated housing and competitive integrated employment, or intentional communities such as sober housing or center-based day activities. Influence of comments in this theme can be seen in person-centered planning, transition services, housing and services, and employment. 2. Financial resources, 51 comments. People noted that rates for reimbursement of service and affordability of services are important. They also noted that there should be adequate funding for services. Influence of comments in this theme can be seen in transition services, waiting list, health care and healthy living, and crisis services. 3. Quality assurance / accountability, 41 comments. People expect agencies to be accountable for the goals within the plan. Work needs to be transparent and consistent in order for the public to hold agencies accountable. People also express the need to resolve conflict with agencies in a more effective and efficient manner. Examples include having a clear understanding of who will monitor providers to ensure that they are implementing person-centered plans and ensuring that individuals have opportunities to make informed choices. Influence of comments in this theme can be seen in person-centered planning, transition services, and plan management and oversight. 4. Access, 41 comments. People shared that not everyone can access the programs or services. This may be physical access, lack of awareness about programs or services, and/or policy barriers that prevent access. For example, a person may need services, but the types of services they need are not available in their area, or they may need services but they do not meet the qualification criteria to enter a given program. Influence of comments in this theme can be seen in transition services, housing and services, employment, lifelong learning and education, waiting list, transportation, and crisis services. 5. Risk, 35 comments. People expressed concern about personal safety. People perceive the opportunity to try different things as a risk, particularly if there is no option to return to what they were doing previously. Making changes in our lives is always a risk, and we need to understand how that change may impact us positively and/or negatively. Influence of comments in this theme can be seen in person-centered planning and transition services. 6. Person-centered, 28 comments. People feel strongly that individuals should be able to make informed decisions in all areas of their lives. For example, people with disabilities should have opportunities to make informed decisions and not be told they only have one option available. Influence of comments in this theme can be seen in person-centered planning, transition services, housing and services, employment, and lifelong learning and education. 7. Barriers / disincentives, 24 comments. People shared that there are many policies that prevent individuals, families, and businesses from achieving the Olmstead vision. An example would be a policy that requires a person with a disability be determined unable to work in order to receive services that they need, when in fact they can work. Influence of comments in this theme will be identified in work plans that correspond to the measurable goals. 8. Engagement, 24 comments. People said that individuals with disabilities should be meaningfully involved in the direction of those policies and other things that impact their lives. While each individual defines meaningful engagement differently, their voice is important and needs to be heard more consistently. "Nothing about us without us" is often quoted by people with disabilities seeking changes to policy. Influence of comments in this theme can be seen in community engagement. 9. Data, 22 comments. People are dissatisfied with many of the data sources being used. They express that data needs to be robust and understandable. Many people feel that as a state we collect a great deal of data about our citizens. Based on comments received, it has been difficult for people to understand why we used certain data in the past. Many people also shared that they felt some data was too limited and didn't represent enough people with disabilities to be impactful in making change. Influence of comments in this theme can be seen in cross-agency coordination of data strategies section and all topic areas. 10. Training and technical assistance, 22 comments. People said that training and technical assistance is needed for everyone. An example would be training for creating person-centered plans so that there is consistency in how plans are being developed statewide. This training should be available to providers, advocates, people with disabilities, and their families. Influence of comments in this theme can be seen in person-centered planning, transition services, housing and services, employment, lifelong learning and education, positive supports. 11. Accessible communications, 22 comments. People are dissatisfied with the current level of accessibility in state communications. Providing accessible communications will lead to transparency and awareness. An example would be documents that cannot be read with a screen reader or only providing information through a website. Influence of comments in this theme can be seen in the Communications and Public Relations section. The August 2015 Plan. The August 2015 Plan focuses on setting measurable goals to both 1. Increase opportunities for people with disabilities to receive services that best meet their individual needs in the most integrated setting, and 2. Improve service delivery to promote a better quality of life. In this way, the plan differs from the original and other previous versions, which laid out processes to implement tasks, but in many areas lacked measurable goals to achieve defined outcomes. Going forward, the Olmstead Plan will contain measurable goals and broad strategies to achieve them, but the detailed actions to implement the strategies will be contained in separate work plans created by the responsible agencies. In October 2015, work plans will be posted on the Olmstead website and submitted to the U.S. District Court. The Sub-Cabinet will review progress on the work plans on a periodic basis. More information on the work plans is available in the Plan Management and Oversight section. During the drafting of the current plan, care was taken to make sure all content from the original and previous versions of the plan was accounted for. To verify this, a comparison document was created showing all of the action items from the March 20, 2015 plan and how they relate to the August 2015 plan and agency work plans. The comparison document is posted on the Olmstead website and available to the public upon request.